Hi, everybody. I am joined by the wonderful Dr. Nicola Ducharme. How are you today?
Very, very well. How about you?
I'm really good. Thank you for joining us, and thank you especially for contributing your phenomenal chapter on Lyme disease and co-infections.
Yeah, you're so welcome.
Thank you. So tell us a little bit about yourself and how naturopathy found you.
Well, I grew up in Australia and I live in the United States now. I've actually lived here in the States for longer than I lived in Australia, which is quite frightening to think about. And so I always grew up in a very sort of health conscious environment. My mum was a total health nut. Used to take us bushwalking every 5 minutes when we were kids. And so I got into the fitness industry, worked in a gym when I was in undergrad in Australia. And then from there got interested in nutrition and studied that. And then it sort of expanded to naturopathy. Actually, when I met a naturopath in Australia, and it had a really profound impression on me. So then I decided to study naturopathy, but I had a bit of a love affair with New York. And so I found myself back in the States and sort of studying externally there. And then finally decided, if I wanted to live in the States and I love natural medicine, I ended up going back and getting my doctorate in naturopathic medicine in Seattle, Washington. And I know that's a qualification that doesn't exist in Australia, so it's a little hard for Australians to relate to, but it was wonderful, and it's really allowed me to stay here and have a really great scope of practice and do what I love. And so it's been phenomenal.
Brilliant. And how did you get to Lyme disease? Because it's such a very specialized area, and I mean, obviously in the area in San Diego, there's such a huge prevalence.
Yeah, I mean, all around the United States, and I really think all around the world, Lyme disease is a significant problem. And one of the biggest factors is the politics of it and the acceptance or lack of by the governments and the healthcare institutions. But many, many, many people are affected. So I got into it just slightly by accident. I was working with kids on the autism spectrum, training with a doctor here who that's really what he did. And I was very blessed that he trained me in that. But I would start meeting with parents, like seeing some of the moms of these kids, and they were like 30, 35 years old. And they were like, oh, I'm exhausted all the time. I've got headaches. Everything hurts. Like, I thought it was just kids, but then I realized there's something more to it. And so kind of going from a functional medicine approach, Lyme was one of the things I would test them for, and it just kept coming up and coming up. So it just sort of evolved that way.
No, definitely. And now predominantly your practice and all the training as well that you do for clinicians is around Lyme and co-infections.
Absolutely, yeah. I mean, my practice is 99% Lyme at this point.
Tell me a little bit about the extra training that you offer clinicians as well.
I saw a bit of a need. So there's an organization called ILADS, which is the International Lyme and Associated Disease Society, and they're really at the forefront of, bringing doctors together who believe that there is such a thing as chronic Lyme, and that 2 weeks of antibiotics doesn't fix everybody. And so I've been aligned with them for several years now, and they offer great conferences and they have some physician training programs. But I realize that not everybody can make that commitment. Not everybody can travel and get to them, especially clinicians abroad. And ILADS, while being relatively integrative, has a more allopathic bent. I mean, that's just sort of more the influence of the organization. And so I thought, especially for naturopaths, to have an online training that's accessible from anywhere in the world, and that walks them through everything from, signs and symptoms to lab testing. And the program I developed is 10 modules. So it's over 20 hours of training. And actually only one of those modules is on antibiotic therapy. So I do cover it if there's MDs or somebody, and just for naturopaths too, to be familiar with the antibiotic protocols. But I mean, there's a whole chapter on detoxification. There's a whole module on hormonal issues in Lyme disease, herbal approaches, mental, emotional, components. So I tried to be really sort of broad and comprehensive with it. And the feedback I've had so far is it really, really helps clinicians to get a deeper understanding, as well as sort of break it down into more simple, like, where do I start? What tests do I rely on? Where do I start? What are the treatment priorities? And, obviously as naturopaths, and this is part of the beauty of our profession, we all have our ways. We all have our modalities we like. We all have our favorites. So I've given sort of guidelines that then a clinician could plug their favorites into. But I also provide a lot of like very detailed, like protocol kind of information.
That's amazing. And I think that that's such an exceptional resource for people, and we'll make sure you'll send me some links and we'll put it up so that clinicians know how to find it. I mean, the Lyme disease phenomena is completely off the charts. And I think it's this, not discussed phenomena that occurs, and it underpins so many conditions. And I mean, you think of anything from reproductive to neurological to whatever, it's underpinning, and that infective driver of so many conditions is quite alarming. Are you seeing, this sounds ridiculous because I'm sure you are, but I guess I'm wanting to get a sense of how you're seeing it evolve. But are you seeing a curative path for people, and are you seeing recovery?
Yes, I am. And I would also add that it's neither quick nor easy.
Yeah.
And, I am very integrative, like I said. So if I have a patient came to me and said, I got bitten last week, and this happens, I got bitten last week, and, now I'm feeling flu-like symptoms, or I've got this rash or whatever, I'll put them on, an aggressive dose of antibiotics, just because it's like whatever it takes now to save you the drama down the road. But once it becomes chronic, I mean, antibiotics do have their place, but there's so much naturally that can be done. And people do get into remission. But we don't say cure. Once it's chronic, we don't say it's gone forever. We say we put it in remission. We knock the, pathogen load down. We get the immune system and like the host health to be improved, so that the body can cope with it by itself. And then we sort of have to deal with the collateral damage of, adrenal fallout and thyroid disorders and neurological, the chronic inflammation, all of that stuff. So yes, I think we're finding our way, but without the research dollars, there's not the quick race to the cure, kind of race to the answer. Yeah. And so it's really practitioners sharing information, sharing what works. We've got some great herbalists who are writing about it. So I think we're getting there, but the politics definitely hold back the development of effective treatments.
Yeah. And if you could have your wish, where would you like the research to go? What would you like to see achieved?
Well, I have seen some research studies lately on different herbs and their, efficacy against Lyme, which is great. I think we need a lot more effective diagnostics.
Yeah.
And it's not even like once people get to somebody who specializes in Lyme and knows where to order the testing, then they're okay. Then they can get reasonably effective testing. We have some great Lyme specialty labs around the world, in Europe and here, that can do a reasonable job. But it's that first screening where people are just at their sort of general primary care doc or their GP saying, oh, can you test me for Lyme? And they're like, okay, well, we'll run this, ELISA or whatever it is. And it's that initial screening that is useless, it's so useless. So a lot of people go untreated for years because they've already been told, like, we ran your test, it was negative, you don't have Lyme. So that's one of the big areas. And then just, how to integrate different therapeutics. So, I do a lot of IV nutrients, IV vitamin C. I love ozone therapy. I mean, I have got patients who do Rife therapy. There's herbs, there's homeopathy. Nutrition plays a huge role. Like, bringing all those things together and really figuring out what the common ground is that's going to help the broader population of these patients.
Yeah. Yeah, no, that's amazing. Okay. And where to from here for you as a clinician, both in Lyme and where are you heading, and are you doing any new things we should know about? And
yeah, so I'm sort of taking a bit of a hiatus from like writing and creating. I've got 4 books published now on Lyme disease, and they have made me happy, and they've made me, and they've helped patients. And so I have great pride in that. And the online courses, there is a practitioner version, and then there's the patient version as well. So I'm sort of all like written out for a while. So I'm just really focusing on private practice and seeing patients, but also trying to bring together a team of people who can provide those really comprehensive integrative solutions. So I'm bringing on board an acupuncturist, and we're looking at different IVs and, just trying to get a little bit of a broader offering for people who need it.
It's isn't it interesting how if you sort of look at over the last 15 years how it's changed specifically in this area, and you know it's a very key specialized area, and it holds its own in its depth of influence both in a negative and a positive way. And I think it's so vital that there are clinics like yours that can really help this tailored, individualized approach for people. And definitely, I mean, getting the information out there is number one. So
yeah, and it's, you know, I consider myself very, very blessed, because when there was first awareness of Lyme in Australia, it was very grassroots. There was some, you know, ABC primetime stories or 60 Minutes, and then people were like, oh, that sounds like me, you know, and they were like relating to that, and then going to look it up and then looking for help. You know, it didn't come from the medical establishment. It came from people talking to each other, social media, seeing some of these media covers. And, you know, at that time, I just feel really, really blessed to have been able to kind of try to bridge that gap a little bit, like being that I'm Australian, I do clinics in Sydney, I see patients in Australia. And so there's that sort of sense of familiarity, but then I'm also in the US, so I can go to the US conferences, and I've got mentors here who, you know, taught me in the beginning. And so my hope is that I've been able to sort of just bridge that gap for some of the Australian and New Zealand patients. And that's been really, really rewarding for me over the years.
No, that's fantastic. Look, I mean, what you've contributed to this area and this body of work is phenomenal. And I'm so grateful that we could include your work in the chapter. And I think people will get so much out of it. I mean, I just loved how you took everyone right through all the aspects, both the pharmaceutical as well as all the naturopathic, and then all the modalities within naturopathy. And I think it's really rewarding both as a clinician and a human being to see just how all of those things can play out. And I'm really excited to get that content to people. So thank you very, very much.
You're welcome.
Thank you. And thank you again for today. Appreciate your time.
No problem at all. Take good care.
See you.